Bring in now Congresswoman Claudia Tenney, a New York Republican who supports the bill. Congresswoman, thank you for coming on. I can't wait to get your perspective on this. So you heard our report there, and you heard Phil say the President and the Speaker of the House spoke this evening. I'm sure you saw the Speaker very terse saying the President wants a vote tomorrow. That's it, we're going to do it. Did not answer questions. What do you think? Do you have the votes?
I don't know, but I know we had a very lively, very impassioned conference this evening, which was really great to hear all my colleagues speak on the issue. I consider myself a conservative Republican from New York. I've, in fact, been the conservative of the year in New York. And we've been fighting to get what we can for our taxpayers and to help our constituents, especially the truly needy, the people in our communities who have special needs, senior citizens, everyone who is, especially, again, our small business community. We're struggling to get something, but we also want to make sure we phase this in. And I think that everybody acts like the sky is falling, and this is all going to be down to this vote, and it's do or die. I mean, we debated Obamacare for years, even after it was passed. We weren't able to get anywhere, but now here we are. We've got the President, we have the House, we have an opportunity in the Senate to compromise and come up with something.
This is your moment, you believe.
Yes,
you mentioned seniors, but if you look at what is estimated here, what it shows is that many seniors are going to pay much more money. And
actually, that's not true in New York at all. In fact, New York has a 1-to-1 ratio in determining whether you can discriminate against someone based on age. So that's not even going to be a factor in New York. And in my district, where Donald Trump won by a 60% margin, this isn't even a factor in New York State. So I'm from New York, and it's going to be not even a factor in New York. We've actually advocated for more for our constituents. We've put in a very unique amendment in New York, which would actually remove the county share. New York is one of the very few states left that imposes this county share. It will save my district $167 million a year in unfunded mandates from the state. And this is something that can easily be taken care of through Governor Andrew Cuomo and his budget, where he has almost $15 billion, as was reported recently in local news accounts in his budget. He has plenty of room to take care of this. And also we have, as I said, our New York State has already got many regulations in place that are going to protect our seniors. And I'm confident that we're going to be having the votes in New York. I mean, we're going to do well.
I want to bring Steve Israel in here, because I could see him, he's disagreeing with you.
Yeah,
why do you disagree?
I agree with Claudia's assessment that she doesn't know whether the bill is going to pass tomorrow. I think that's the most accurate thing we've heard. But I fundamentally disagree with her assessment with respect to the cost increases, particularly for seniors. What she's referring to, what the Congresswoman is referring to, is a special deal that was made for New York members of Congress to get their votes that says that counties no longer pay their share of Medicaid, but that it's shifted to all of the other taxpayers of New York State. So this is the quintessential robbing Peter to pay Paul. There is nothing that is free in Washington. This is just shifting the burden to New York State, which is going to have to increase the income tax, and property taxes are going to go up.
Absolutely not.
And the elderly continue to pay higher premiums.
Okay, go ahead, Congresswoman.
I respectfully disagree. That's completely untrue. I was a New York State Assembly member, and the governor has what I call an unconstitutional slush fund to the tune of billions of dollars. Hundreds of millions of dollars have been spent by this governor against the interest of the taxpayers to meet his needs and to leverage his interests against those of the taxpayers and to buy off basically other members in the House and also in the Senate. There is so much more room in this state budget. Right now, Medicaid consumes about $65 billion of the state taxpayers' budget, and out of a $152 billion budget, there are 19 million people in New York, 38 million people in California, and our budget is coming close to what the California budget is.
I don't want to get too in the weeds just about New York City, but I mean, these are the conversations that you have been having and have had this evening, correct?
Yeah, absolutely. I think we've been fighting for a deal. Look, in a free market system that we don't really have in New York, we'd have concern. This bill is really not a full repeal. It's the best we can do in light of what's happening with the Senate. But I'm pleased that we're getting somewhere, that we're actually going to provide some relief. I own a small business. I've had to look at people and say, we provided great insurance for you, my employees, and now guess what? We have to comply with Obamacare mandates, and so we've had to lose employees just to be able to keep up with them. We've had to go on to self-insurance. I mean, there's a lot of people who have been hurt by this terrible bill, especially in New York.
For time.
Thank you. I appreciate it.
I really appreciate you joining us. Thank you.
Thanks
so
much. I appreciate it.
Again, now you guys see the kind of thing that's happening. You know, robbing Peter to pay Paul. I disagree with you or whatever. I mean, healthcare is complicated. So we're going to move. We'll get back to my panel. I want to bring in now New York Times columnist Nicholas Kristof. Nicholas, good to have you on. Burning the midnight oil. You heard the conversation I just had with the Congresswoman. They're at the White House tonight. They're trying to salvage health care replacement, the bill here. The president wants a vote tomorrow, and let the chips fall where they may. How are you calling it? Do you think this is going to pass the House?
Well, look, I mean, I think journalists